My name is Dr. Tim Chapel, and welcome to another segment of Medical Miracles. In our past segments, we have talked about the science and art of denture construction. We've talked about smile design, speech, fit. We've also talked about implants and the advantage they offer to improve your bite force and your chewing efficiency. For those of you who haven't seen these segments or would like to review them, they can be found on JTV's webpage. Today, we're going to have testimonials from two patients. They will talk about their experience in having their dentures done at our office. One lady will talk about her experience, and one gentleman will talk about his dentures and his implants. This is our first patient, Hilda. Hilda, we met last fall when you came to my office. What brought you to our office in the first place?
Well, for years I have fought to save my teeth, and I lost the battle, and Dr. Lamoureux referenced you as being the best person to do the job for me. And so I came in and, needless to say, cried in your chair.
Yes, I remember.
Going through the grieving process, yeah. And you were very, very kind. I want to thank you for that.
Thank you.
And then you explained to me what I had to go through, and so I decided, well, got to be done. And actually, the fear was there after I got through the grieving process, that, you know, that you don't know how much pain you're going to go through, and I found out that it wasn't as painful as I thought it was going to be. After that, we did all the impressions. That was interesting, having all that gunk in my mouth, but it wasn't bad, you know.
Good. Good. What your expectations? Because you only go through this once, and you hear things that your friends say, you read things along the way, you have certain expectations on what you're going to experience with the actual appointment when you have your denture made and delivered. Did you have anxiety beforehand?
Oh,
or
yes.
were you resigned? You did?
Oh,
okay.
yes.
All right.
Yeah, it's fear of the unknown.
Yes.
You know,
Yes.
because, and I think it's anything you go through, you know, you just have a fear of the unknown. And then after that, you know, as we went through the process, it got better.
So as we met and took impressions and selected the teeth that we were going to use and discussed your smile and what to expect, would it be fair to say you became more at ease as time went by before the actual appointment where we had all this done?
Right.
Okay.
Right.
And the appointment itself, when all is said and done, how did that go? All things considered, for what you were expecting.
Well, I think it went very well.
Good.
Yeah. I would recommend, you know, if somebody has to go through this, I would recommend to not be as afraid as I was.
Okay.
You know, that I think fear is your biggest thing.
And how was the staff? How did everybody treat you here at the office?
Oh my gosh, you're wonderful. Okay. Wonderful. And they laughed at my jokes.
They are very nice. They're very kind. And I think that's an
yeah.
important part of the process, is that everybody has compassion, you know, for you going through this.
Oh, yes. That was the main thing that I noticed, was the compassion. You know, they, I'm going around, you know, with tears, and they're, you know, saying, oh, poo-poo, you know, this is nothing. You know, and if you take better care of your teeth, you wouldn't be here. You know, that sort of thing.
Right. Oh.
Never got that.
No. Well, it was last fall, and it is June now.
Uh-huh.
So in the time that has passed, any regrets?
No.
Okay.
No. In fact, I was thinking just the other day, oh my gosh, I don't have to have any more fillings in those teeth. You know, so.
But you're still, because you were able to keep your lower teeth, you're still going to come in every 6 months and have a cleaning and a checkup.
Yes.
And if anything comes up along the way, by all means, you know, you can feel free to call.
Right.
Well, I thank you for your time today. I appreciate you coming in and sharing your experience with everyone. It's very kind of you.
Well, it was kind of you to be nice to me to go through this stuff.
Well, you're very welcome. It was fun. I enjoyed it.
Well, anybody has a lizard in their plant. It's got to be fun.
The lizard is a toy lizard from the toy box. It's not real, but if you can pick that up in the plant, you've overcome the fear. Right. Thank you so much, Hilda. I appreciate it.
You're welcome.
Okay. I would like you to meet Tom. Tom, it has been 9 years since we made your original work, your original dentures, and it was 6 years ago that we placed 4 implants in your mandible, your lower jaw. 6 years later, how are things going with your implants?
Great. Great.
Good. Everything still snaps in place? And
Yes, it does.
fits well? Okay.
Good fit.
Good. It seems I remember that there was a deal that we made when we put the implants in place. You wanted me to promise you that you'd be able to enjoy a tender steak.
Yes.
Do you recall that?
Yes.
You're able to do that? Okay.
Yes.
Okay.
No more adhesive on my lower
right,
denture.
Right. So you used quite a bit of that beforehand?
Yes.
Okay.
And it would always be gone about supper time.
Okay.
So, no problem anymore.
Good. Now, I don't recall that we've really even had to change attachments.
No.
It's just
It's been great.
worked right along all this time. Okay. Would you share with us what it was like having your implants placed? Because you only have this done once, you're really not sure what to expect. But the actual procedure when you had them put in place, how did that go?
Went very smooth.
Okay.
Very good. No pain.
Good. Because it
was quite an experience.
Yeah, well, I'm sure. But it was just done with local anesthetic.
Right.
You weren't put under with an IV sedation or anything like that. It was done right here at the office in the dental chair. Okay. Now, when you say it was quite an experience, elaborate if you would, please.
Well, it kind of reminded me like when I went up in St. Louis Arch, because the car that you ride in ratchets up there,
Yes.
and
Yeah.
and putting in my implants,
Mhm.
it was a ratchet thing.
Yes.
Screwing them in my bone.
So the sound and the experience was new, but the discomfort
Yes.
was minimal?
No discomfort.
Okay, very good. Would you recommend implants to someone who had a lower denture that wasn't stable, required a lot of adhesive?
Definitely.
Okay. Are you still able to enjoy a tender
yes.
steak?
Yes, I am.
I forget what kind of steak that was.
Well, with filet mignon, you don't.
Okay.
That's pretty tender to start
Okay,
with.
good, good. And when we made the original denture, I know we took some time to select the teeth that we used as far as the size and the color and the shape. And I like your smile. I think it's turned out very well. I know it's been 9 years, but do you recall what your wife said or commented on, or did she have any?
It's just, I think, I just didn't have any more problems with my dentures.
It was as much functional for you as anything.
Yes, it was.
Correct. Tom, when you first came to our office, I know that you were already a denture wearer. You had an upper denture in place, but you still had some lower teeth that we were
Yes.
working with and working around. How long have you been a denture wearer?
Oh, probably 10 years before
Okay.
that I met you.
Okay. And what you wanted to accomplish was a better fit and better function? Would that be fair to say, or better smile?
Well, actually, I went to my wife's dentist first,
Okay.
and it was humongous expense, which my insurance one's going to pay for.
Yes.
And he sent me over to you.
Oh, okay.
And that's how I got
That's
over
how it
here.
came about?
Yeah.
Okay. All right.
So that worked out good.
Good. Well, I'm glad to hear that. I think it did too.
And then you made me a new denture.
Yes.
And then, like what, 3 years later, I came in and you showed me that little model.
Mhm.
How'd you like to have that? And I thought it was a great idea.
Good.
So it's been smooth sailing since then.
Well, good.